All right, so at this time, we will be talking chapter 6 of still module 7, module 9, sorry, of palliative care. It's understanding end of life care. So, again, when we talk about end of life care, it's care in final stage of a person's life. In this stage, we are focused on the comfort and dignity of the individual and supports client and the family, right? So that's what basically end of life care is. Our goals of care, making sure that we are relieving the pain because we are providing comfort, managing the pain, maintaining the dignity of the individual or the client, provide emotional support for the client, for the family members, and to your coworkers if it's possible too. And we need to respect their desire and wishes during their end of life care. Okay, so these are some of the goals of end of life care. So, what are the signs if approaching death already? So, of course, the client has decreased appetite or the loss of appetite, anorexia, is what we have discussed in our previous chapters. There might be some weakness, visible weakness of the physical side of the person. The breathing changes. It could be like too fast or too slow, anything like that. And the client starts to get to decrease unconsciousness, starting to get unconscious, right? So they will start like that. Basically, the person's physical aspect will decline, right? So that is the signs or the visible signs when the person is approaching death. Also, it could be it has a cool skin, like the skin, if you will touch them, it's too cold. There might be some irregular pulse rate as well. Labored breathing, like they're catching their breath heavily, and they have minimal output. In terms of emotional needs, for sure they might start getting afraid and anxious. So make sure always be there for them, for the family as well. If they are prayerful, if they are religious, just be with them and respect that choice of the family members and the client as well. Need reassurance that you will always be there no matter what happened, making sure that the loved ones is there present. And again, it's what I mentioned to you, if there's the religious, respect their spiritual needs. Okay, so your main role, same thing, make sure you provide comfort for the individual, also for the family members, maybe emotional comfort, assist in terms of hygiene if the person, even the person is like, showing some signs of dying. Make sure you still clean them. That maintains their dignity. And once they will pass away or they will be declared death, make sure you clean them before transporting or before someone from the morgue will get them, like postpartum postmortem care, right? So that's very post-mortem care, so that's very important. Next, also, of course, your emotional support, as what we have been discussing all the time, and report any changes, right? Report and document any changes. So those are some the basic needs that you need to always do. What are the comfort measures? We have discussed this also from the previous chapters. Of course, repositioning, making sure that you keep the client clean and not dry at all times, oral care or mouth care, and of course, a quiet and peaceful environment, right? For them to like really rest and feel comfortable. For communication, you need to speak calmly. You need to speak slower than usual so that they can understand you. Make sure you listen actively if they are talking or the family members are talking to you. Support the family as well and respect the silence. If they just want a quiet room, then give that to them, right? It's very important that we should know how to communicate with them professionally in this difficult time. When we support the family, it makes sure that we also support them in terms of emotional, provide information that you're allowed to give, that is under your scope of practice. Respect their culture and beliefs. Make sure you don't judge whatever they think it's good for their dying loved one to do because it's part of their culture. Then respect that and be it. And you need to be make sure that you are compassionate and always respectful and professional at all times. right? It's not easy of what they're going through, so please be compassionate. Of course, after the death care, as what I've mentioned to you, the post-mortem care, follow the procedures of your company policy, maintain the dignity of the client. You need to cover everything. You should not expose the client. Oh, the client is dead, so we can expose it. No. Make sure you always respect and maintain the dignity of the client. And if there's special practices that the client culture follows after death, we need to also respect that practices. Okay, it's very important. Next will be the professional boundaries. As what we have mentioned from the previous chapter, stay professional at all times, avoid over involvement of the things, and always be respectful, right? So this is just same professional boundaries that I've been telling you from the other chapters. So I don't need to explain it further, but yeah, again, stay professional, avoid over involvement, be respectful of their beliefs, culture, and choices. So for caregivers, for you guys as PSW, make sure if you need support, always ask your supervisor to seek support. You also felt the loss, right? Because you've been taking care of that individual. Recognize your emotion. If you need to cry, you can cry, definitely, yes, because you are only human being too, and you build the relationship with that person as well, right? Especially if you've been taking care for that person for a long period of time. And as much as possible, you need to manage your stress as well. Remember, I think in the earlier modules, I taught you how to manage your stress, making sure that you will follow that. Okay, it's also important that that you've been taking care of yourself, and aside from taking care of others. Okay, again, recognize your emotion, seek support if needed, and manage your stress. Again, same key reminders for each chapter. Focus on the client's comfort. That's palliative care approach. Respect the dignity. It's still a palliative care approach. Always follow what's in the care plan because that will be your guide. And always be compassionate at this difficult time. All right. So later on, I will be giving you another essay question for chapter 6. If I'm not mistaken, this is chapter 6. And yeah, but for now, we'll just focus on the lecture proper first. Okay. So that's it for chapter 5. Have a good day.